about so-called comparative effectiveness, and I brought notes because I know this is a big question. Let me go to section 219 of the bill. 219 of the bill, which on my copy, let me see if I can get it right. Sorry to do this to you folks, but
no, you're not.
Part of what we do.
Doesn't know what he's talking about.
219. Find it. It won't take too long. 219 of the bill, for all the discussion. By the way, public option, 14 pages in the bill on 685. It's not the bill, but I'll talk about that later. Section 219. Section 219, Center for Health Outcomes Research and Evaluation. By the way, the person who was a big part of this discussion about what should happen at the end of life was John Isaacson, a conservative Republican from Georgia, who is a very decent person, a very good guy, one of the best. I like working with Republicans, but not all. He's one of them I really like working with. He's a good guy. He's the one who raised this issue. You'd think it was raised by some other folks. But here's what it says. I don't read all of it. This is about 11 pages, but
read you
2 sentences. The agency, meaning health, education, health and human services, the agency in the federal government, which will be headed by a Democrat and years from now will be a Republican and it'll change parties. But in that agency, the Secretary shall establish the Center for Health Outcomes Research and Evaluation, referred to as, quote, the Center. Here's what they're going to do. Collect, conduct, support, synthesize research with respect to comparing health outcomes, effectiveness, and appropriateness of healthcare services and procedures in order to identify the manner in which diseases, disorders, or other health conditions can most effectively and appropriately be prevented, diagnosed, treated, and managed clinically. Now, I realize there's some language in there you're scratching some of that mean. Well, how will that work? Here's what we said in the bill on purpose. On purpose we said this. That's on section 219. In section 219, about the 10th page, and I'll give you page numbers, that'll mess everybody up. About the 10th page of 219 in the Senate bill, forget the House, that's not my job. Here's what it says on line 5 of this particular page. Center reports, meaning that center I just described in their duties. Center reports and recommendations shall not, I'll say it again if you want to, be construed as mandates for payment, coverage, or treatment. Those reports that they produce, the recommendations they produce, shall not be construed as mandates for payment, coverage, or treatment. I think that our bill covers the concern that you're talking about. If you think that that's not enough, if that is too much leeway, or if that creates problems, maybe we should change it. That's one of the reasons we're having this discussion. But I just asked you to read this and forget about it.
This one?
Yeah. I have a vote in the Senate. He doesn't. Okay, I'm one of 100 people, but I'm playing a bigger role in this than even some other quarters. So, in the House, I realize the language is different, and the Finance Committee might weigh in. We should keep talking about it because it's important, because people are worried about it, and they're in America, and they hope that when they're very sick that their family can get treated. Do you have any follow-up on that?
Well, thank you very much. I appreciate what you're saying.
Sure.
I actually appreciate the fact that, as opposed to some of the other people in the House and Senate, you've actually read the bill, and that puts you a step ahead of a lot of the other people involved in this decision.
It wasn't easy. Don't read the biologics department unless you spend some time.
However, what I do want to say, just in response to what you said, is that even though obviously what Ezekiel Manuel does not,